Ghaith Prometric Mix Question and Answers, Part 3. A 3-year-old child has an elevated body temperature and administered oral aspirin. The nurse records the body temperature of the child 2 hours after. And the American Academy of Pediatrics suggests that removal of the tonsillitis under certain conditions. Which of the following meets these conditions? A. Times viral tonsillitis per year. B. Infrequent snoring and nasal quality. B. 3 times bacterial tonsillitis per year. D. Tonsillitis accompanied by adenoid inflammation. The answer is D. Tonsillitis accompanied by adenoid inflammation. A 5-year-old child is post-operative after tonsillectomy. The nurse should ask the parents to give the child which of the following food after discharge from the hospital. A. Meat and rice. B. Hot dog and potato chips. C. Mashed potatoes and soup. D. Cucumbers and tomato salad. The answer is C. Mashed potatoes and soup. The nurse is receiving a child post-operative tonsillectomy. Which of the following nursing assessment is suitable for the post-op care? A. Encourage the child to cough spontaneously. B. Observe for subtle signs of hemorrhage. C. Place the child in the prone position. D. Suction the mouth to clear the air because of violent behavior. The answer is B. Observe for subtle signs of hemorrhage. The nurse is receiving a child post-operative tonsillectomy. Which of the following nursing action is suitable for the post-operative care? A. Encourage the child to cough spontaneously. B. Observe the subtle signs of hemorrhage. C. Place the child in the prone position. D. Suction the mouth to clear the airway because of violence. Answer is C. Place the child in the prone position. After tonsillectomy, a child begins to vomit bright red blood. The initial nursing action is to A. Notify the physician. B. Turn the child to the side. C. Maintain the NPO status. D. Administer the prescribed antiemetic. The answer is B. Turn the child to the side. A client presents with hypocalcemia, hyperphosphatemia, muscle cramps, and positive Trousseau sign. What diagnosis does this support? A. Diabetes insipidus. B. Conn's syndrome. C. Hypoparathyroidism. D. Acromegaly. Answer is C. Hypoparathyroidism. The nurse cares for a client who has undergone a tonsillectomy. The nurse is most concerned about which post-operative finding? A. Lack of appetite. B. Throat pain. C. Frequent swallowing. D. Nausea.
C.
The answer is C. Frequent swallowing. An 18-year-old man, college student, was rushed, fainted at the school. He complained of severe quadrant pain. Upon palpation, he jerks, even with some simple touch. What is the most likely diagnosis of this patient? A. Appendicitis. B. Liver cirrhosis. C. Kidney stones. D. Duodenal ulcer. The answer is A. Appendicitis. A 9-year-old child was admitted with suspected appendicitis. A nurse was evaluating the child's condition, and the mother stated that the child did not move his bowel movement for the past 2 days and requested for laxatives. What is the risk of giving laxative to patient with appendicitis? A. Pain. B. Fever. C. Rupture. D. Diarrhea. The answer is C. Rupture. A man is to be discharged from the general appendectomy. The precautionary measures plans are discussed with him. What is the most important desired outcome after discharge? A. Remain free of post-surgical complications. B. Report fever, redness, or drainage from the wound site. C. Use pain management techniques appropriately. D. Resume gradual activities and avoid weight. The answer is A. Remain free of post-surgical complications. The nurse would increase the comfort of the patient with appendicitis by A. having the patient lie in prone position. B. Flexing the patient's right knee. C. Sitting the patient upright in a chair. D. Turning the patient into his or her left side. Answer is B. Flexing the patient's right knee. A 10-year-old girl presents to the emergency room with pain. On assessment, you notice that when you palpate the right lower quadrant of the child's abdomen, the child feels pain in the right quadrant. Which of the following is the name of the sign? A. Rebound tenderness. B. McBurney's sign. C. Roving sign. D. Obturate sign. The answer is A. Rebound tenderness. A 10-year-old girl presents to the emergency room with pain. On assessment, you notice that when you palpate on the left lower quadrant of the child's abdomen, the child feels pain in the right quadrant. Which of the following is the names of this sign? A. Rebound tenderness. B. McBurney's sign. C. Roving sign. D. Obturate sign. The answer is C. Roving sign. Roving sign describes with right lower quadrant pain elicited by palpation of the left lower quadrant in acute appendicitis. It is said to be positive roving sign, or more correctly, the Perman roving sign. While the McBurney sign is the individual should be lying on their back on the examination table. A clinician will apply slow pressure over McBurney's point and then quickly release. The presence of severe pain when pressure is released is indicative of a positive test and raises the suspicion of acute appendicitis. Medication questions and answers. General knowledge. Treatment of nephritis syndrome is corticosteroids. Isoniazid is for TB, and the side effects are numbness, hepatitis symptoms, stomach upsets, and rashes. A 66-year-old woman with a history of unstable angina and hypertension presents to the emergency department with a dull chest pain that she describes as similar to heartburn. The pain radiates down to the left arm. She had taken sublingual nitroglycerin tablets with any relief, and electrocardiograph is performed and shows elevated ST segments. Which medication is most likely to be given to dissolve the thrombus? A. Heparin. B. Warfarin. C. Streptokinase. D. Aspirin. Answer is C. Streptokinase. Streptokinase interacts with plasminogen or plasmin to form a plasminogen activator in plasma. Plasmin is produced in the blood to break down fibrin, the major constituent of blood thrombi, therefore dissolving clots once they have fulfilled their purpose of stopping the bleeding. The extra production of plasmin causes by streptokinase breaks down unwanted blood clots, for example, in the lungs and pulmonary embolism. A nurse checks the medication chart of a patient, which has the following order: nitroglycerin tab sublingual. Which of the following medication administration routes should the nurse use? A. In the nose. B. In the eyelid. C. Under the skin. D. Under the tongue. The answer is D. Under the tongue. A 28-year-old man admitted to orthopedic ward complaining of throbbing pain in casted leg. Which of the following nursing interventions should be taken first? A. Remove the cast. B. Notify the doctor. C. Assess pedal pulse. D. Administer PRN medication. The answer is C. Assess pedal pulse. A 62-year-old woman presents to the clinic with a primary complaint of fatigue. An assessment shows a smooth and reddened tongue with a loss of papillae and pallid mucous membrane. She complains of a sense of constant fullness of the stomach with a decreased appetite and 2 to 3 loose bowel movement per day. A neurological assessment shows numbness in the feet and lower legs. The patient type of test would be most likely A. Skilling. B. Erythropoietin. C. Folic acid levels. D. Vitamin B12 levels. Answer is D. Vitamin B12 levels. A mother of a patient who is on antipsychotic drug asked a doctor about some more details about the drug. The doctor told the mother that her son is taking an atypical antipsychotic drugs. Which of the following is an example of this type of drug? A. Fluoridazine. B. Clozapine. C. Chlorpromazine. D. Haloperidol. Answer is B. Clozapine. It is a typical antipsychotic drug. Typical antipsychotic drugs has more strongly blockage the dopamine, while atypical antipsychotic drugs have greater effects in serotonin. Typical antipsychotic drugs act on the dopaminergic system, blocking the dopamine type 2 receptors. Atypical antipsychotic have lower affinity and occupancy for the dopaminergic receptors and a high degree of occupancy in serotonergic receptors. Atypical antipsychotics are clozapine, risperidone, olanzapine, quetiapine, ziprasidone, and aripiprazole. Typical antipsychotics can be used to treat schizophrenia or severe agitation. For example, haloperidol, due to the availability of a rapid-acting injectable formulation and decades of use, remains the most commonly used antipsychotic for treating severe agitation in the emergency department setting. A patient with a history of atrial fibrillation has an order of 25 milligrams of drug. The available supply or dose is 0.25 milligrams. Which of the following doses is correct? A. Dispense 2 tablets to the patient. B. Administer 1 tablet twice daily. C. Dispense 1/2 tablet to the patient. D. Return tablets to the pharmacy and reorder. The answer is D. Return tablets to the pharmacy and reorder. A 13-year-old patient is admitted for diarrhea and vomiting. He looks pale and lethargic. A nurse is preparing to give IV hypotonic solution. Which IV solution is most appropriate? A. 0.9% saline. B. Lactated ringer. C. 10% dextrose in water. D. 0.45% sodium chloride. The answer is D. 0.45% sodium chloride. When a patient was first diagnosed with schizophrenia, one of his family members asked the nurse about the possible causes. The nurse said that one reason is that he may have had excess secretion of a neurotransmitter. Which of the following neurotransmitter? A. Serotonin. B. Dopamine. C. Glutamate. Answer is B. Dopamine. The nurse administered a dose of morphine sulfate as prescribed to a patient who is in the post-anesthesia care unit or PACU. The patient appears to be resting comfortably. The respiratory rate is 21 and the oxygen saturation is 86% via oxygen cannula. The nurse should immediately administer A. Flumazenil. B. Midazolam. C. Naloxone. D. Ondansetron. The answer is C. Naloxone or Narcan. Digoxin is not given to a patient who has which of the following? A. Tachycardia. B. Hypertension. C. Tachypnea. D. Bradycardia. The answer is D. Bradycardia. For atropine sulfate is indicated for increase A. Heart rate. B. Respiratory rate. The answer is A. Heart rate. The morphine sulfate side effect. A. Tachycardia. B. Hypertension. C. Tachypnea. D. Bradypnea. The answer is D. Bradypnea. The patient with ongoing magnesium sulfate, the nurse should be alert to A. Temperature. B. Respiratory rate. C. Heart rate. The answer is B. Respiratory rate. A soldier was brought to triage area after being exposed to chemical weapons. The signs and symptoms of nerve gas exposure were noticed. A nurse prepared for medical management. Which medication should a nurse prepare for the patient? A. Atropine. B. Adrenaline. C. Sodium nitrate. D. Sodium thiophosphate. The answer is A. Atropine sulfate. A patient was on regular dose of lithium carbonate. The nurse noticed he has hand tremor, polyuria, diarrhea, and vomiting. What immediate action should be taken by the nurse? A. Diuretics. B. Withholding lithium. C. Calling the psychiatrist. D. Monitoring serum lithium level. Answer is B. Withholding lithium. The mild symptoms of lithium carbonate toxicity are hand tremor, polyuria, diarrhea, and vomiting. A patient was on a course of lithium carbonate drug. During the nurse assessment, she found that the patient has complained from nystagmus, visual hallucination, and oliguria. Which of the following drug-related complications best symptoms? A. Overdose. B. Mild toxicity. C. Severe toxicity. D. Moderate toxicity. The answer is C. Severe toxicity. A 49-year-old woman presented to the emergency department complained of severe chest pain. The ECG showed that the patient has myocardial infarction. The doctor ordered to give the 800 mg of aspirin. What is the primary indication of aspirin in this case? A. Breaks down the thrombus. B. Decreases the formation of platelet plugs. C. Inhibits the conversion of thrombin to thrombin. D. Interferes the vitamin K action. The answer is B. Decreases the formation of platelet plugs. Which of the following condition is a contraindication for a woman with oral contraceptives? A. Dysmenorrhea. B. Menorrhagia. C. Thrombophlebitis. D. Toxic shock syndrome. The answer is C. Thrombophlebitis. A nurse is given a health education to the patient on how to reduce febrile convulsion in the child at home. Which of the following medication is the safest intervention? A. Analgesic. B. Antipyretic. C. Antibiotic. D. Antiemetic. The answer is B. Antipyretic. A home care patient with chronic obstructive reports an upset stomach. The patient is taking an triamcinolone acetonide or Asmacort. Which of the following vitamins is necessary for wound healing process? A. Vitamin A. B. Vitamin C. D. Vitamin D. D. Vitamin K. The answer is B. Vitamin C. Which of the following vitamin supplements can decrease the incidence of neural tube defects such as anencephaly and spinal bifida in newborns? A. Vitamin A. B. Riboflavin. C. Folic acid. D. Vitamin K. The answer is C. Folic acid. A 37-year-old female presented to the emergency room with complaint of symptomatic bradycardia. Appropriate nursing intervention include to establish access. What is the possible drug to be given in the IV solution? A. Digoxin. B. Atropine. C. Anticoagulant. D. Calcium channel blocker. The answer is B. Atropine sulfate. A 25-year-old woman presented to the emergency room with decreased reflexes, hypoventilation, hypotension, and fused pupils. A family member who is accompanying with the patient has battle of diazepam, which the label states was recently with the family members also indicates that the patient has depression. What intervention should the nurse expect to administer? A. Naloxone. B. Activated charcoal. C. Tap water enema. D. Magnesium sulfate to reduce the risk of seizure. The answer is B. Activated charcoal. Activated charcoal has pores that can trap chemicals. It is typically taken by mouth as a treatment for some swallowed poisons. Activated charcoal is commonly used to treat poisoning. It is also used for high cholesterol, hangovers, and an upset stomach. A nurse is giving discharge planning instruction to the parents of a 1-year-old child with acute otitis media. Which of the following discharge instruction takes priority? A. Administer antibiotics as prescribed. B. Administer influenza vaccination. C. Breastfeeding as long as possible. D. Continue using of pacifier. The answer is A. Administer antibiotics as prescribed. A patient comes to the emergency unit with cough and severe dyspnea. The patient's medical history revealed a diagnosis of chronic heart failure and chronic obstructive pulmonary disease. Which of the following diagnostic tests will be most beneficial to a nurse to figure out if there is an exacerbation of heart failure? A. B-type natriuretic peptide or BNP. B. Arterial blood gas or EBG. C. Cardiac enzymes or CKMB. D. Chest X-ray. The answer is A. B-type natriuretic peptide or BMP. A 4-year-old girl was playing outside. She came to her mom crying and holding her right upper arm. She went to the hospital with swelling over the right upper arm, pain, and itching. The appropriate management is A. Maintain patent airway. B. Administer subcutaneous epinephrine. C. Prepare for intubation. The answer is B. Administer subcutaneous epinephrine. An older adult patient with renal failure comes to the emergency department with a report of nausea and vomiting. The client's heart rate is 45 beats per minute. The nurse is most concerned about which medication that the client takes. A. Nitroglycerin. B. Digoxin. C. Doxorubicin. D. Furosemide. The nurse is caring for a 60-year-old in the medical surgical unit. On entering the room, the nurse finds the patient alert, oriented. The skin color appears healthy and pink. The nurse observes electrocardiogram and notices absence of P wave. Which initial action is the most important? A. Defibrillate the patient. B. Do cardioversion. C. Pacemaker preparation. D. Intravenous amiodarone. The answer is D. Intravenous amiodarone. What is the main action of amiodarone? Amiodarone prevents and treats of fast or irregular heartbeat or arrhythmia. It works by slowing down overactive electric signals in the heart, which stabilizes your heart rhythm. During health education for a patient with monoamine oxidase inhibitors or MAOI, the nurse instructs him to avoid certain foods that can interact with the MAOI. Food containing which of the following contents should be avoided? A. Alcohol. B. Caffeine. C. Tyramine. D. Folic acid. Answer is C. Tyramine. One of the examples of tyramine is aged cheese. Why MAO inhibitors is not taken with aged cheese? For this reason, person taking MAOI antidepressants are cautioned to avoid food that are rich in tyramine so that the hypertensive crisis can be avoided. After teaching a 54-year-old patient with angina on how to take nitroglycerin sublingual PRN, which of the following statements reflect the patient's understanding? A. I have to take this medication once I need it only. B. It is okay to take 1 tablet daily to prevent the heart attack. C. I can take 2 tablets together at once if the attack is. D. This medication will regulate my heartbeats and I will be okay. The answer is A. I have to take this medication once I need it only. A 45-year-old client who was diagnosed with brain tumor was scheduled for craniotomy. It is important to prevent the developing of cerebral edema after surgery. What medication would the nurse expect to prescribe to the client? A. Steroids. B. Diuretics. C. Anticonvulsions. D. Antihypertensive. The answer is A. Steroids. The steroids are vital in helping you to function normally in your daily activities. In people living with brain tumor, additional steroids are often prescribed in tablet form. They help to reduce the swelling, edema, and inflammation sometimes caused by brain tumors. This is known as anti-inflammatory effect. Mastitis questions. General knowledge. Mastitis is caused by Escherichia coli, Streptococcus, and V. aureus. Question. A nurse is providing instruction to a mother who has been diagnosed with mastitis. Which of the following statements, if made by the mother, indicates a need for further teaching? A. I need to take antibiotics and I should begin to feel better in 48 hours. I can use analgesic to assist in alleviating some of the discomfort. C. I need to wear a supportive bra to relieve the discomfort. D. I need to stop breastfeeding until this condition resolves. The answer is D. I need to stop breastfeeding until this condition resolves. A primiparous mother who has mastitis is asking the nurse about feeding. Which of the following would be the proper nursing response organism of mastitis? A. It will not affect the newborn. B. It will be deactivated by salivation. C. It will not be expressed in breast milk. D. It will be killed by immunoglobulin in breast milk. The answer is A. It will not affect the newborn. A nurse is giving a health education for a mother who has mastitis. Which of the following, if stated by the mother about what she needs to do, indicate that additional education is needed? A. Take antibiotics. B. Use analgesics. C. Wear a supportive bra. D. Stop breastfeeding. The answer is D. Stop breastfeeding. The nurse was planning care for a 25-year-old primigravida postpartum mother who was engorgement due to poor feeding technique. The left breast appeared red and swollen and was diagnosed as: which of the following is the best education for the mother? A. Avoid wearing brassiere. B. Begin suckling on the right breast. C. Stop pumping milk from the left breast. D. Take antibiotics till the soreness subside. The answer is D. Take antibiotics till the soreness subside. Mastitis is an infection of the breast that occurs most often 2 to 4 days after childbirth. Which of the following is considered first-line treatment of mastitis? A. Drainage of breast abscess. B. Antibiotic therapy and cessation of breastfeeding. C. Antibiotic therapy and continuation of breastfeeding. D. Advise mother to stop breastfeeding until infection is clean. The answer is C. Antibiotic therapy and continuation of breastfeeding. A 30-year-old primigravida postnatal mother came to the clinic and she complained of feeling shivering, redness, swelling and pain in her right breast. With blood pressure of 90/62, heart rate of 84, respiratory rate of 22, the temperature of 38.8. Which of the most common organism that causes mastitis? A. Pseudomonas. B. Escherichia coli. C. Group B. Streptococcus. D. Staphylococcus aureus. The answer is D. Staphylococcus aureus. The nurse is teaching a 32 weeks pregnant woman on how to distinguish between pre-labor, false contraction, and true labor contraction. Which statement about pre-labor contraction is accurate? A. They are regular and increase gradually. B. They are felt in the abdomen. C. They start at the back and radiate to the abdomen. D. They become more intense during walking. The answer is B. They are felt in the abdomen. Which test should be performed to screen for cervical neoplasma during antenatal assessment? A. Papanicula or pap smear. B. Vaginal rectal culture. C. Rapid plasma regain test or PPR. D. Venereal disease research laboratory test or VDRL. The answer is A. Papanicula or pap smear. A woman was diagnosed with gestational trophoblastic disease. What is the lab investigation was done to diagnose the disease condition? A. Cervical pap smear. B. Serum HCG levels. C. Serum estrogen levels. D. Plasma thyroxine level. The answer is B. Serum HCG levels. A multipara mother complained of small vulva and swelling following vaginal delivery of a baby that weighed 3.8 kg. What is the initial nursing action should the nurse advise to the mother to perform? A. Apply ice pack. B. Maintain bed rest. C. Administer analgesic. D. Encourage fluid intake. The answer is A. Apply ice pack.